Opioids are often prescribed to manage severe pain in assisted living facilities. While helpful, they come with risks like addiction and overdose. Safe opioid management is crucial. Caregivers need to understand these medications, know the risks and benefits, and be trained on safe administration. This includes verifying dosage and monitoring for side effects. Facilities must have clear protocols and secure storage to prevent unauthorized access. Regular inventory checks help track medication usage. Everyone involved in resident care plays a role in opioid management. By working together, we can minimize risks and promote resident safety. It's about ensuring residents get the pain relief they need while staying safe. Caregivers are on the front lines of opioid management. They administer medications and monitor residents, making their role in maintaining safety crucial. Caregivers interact with residents daily and are often the first to notice changes in behavior or health. Thorough documentation is vital, including medication, administration times, dosages, and observed side effects. This helps track medication use and identify discrepancies. Open communication with medical staff is essential. Caregivers need knowledge and training to administer opioids safely. They should feel empowered to speak up about concerns. Ongoing education and resources support caregivers in providing the best care. The Medication Administration Record, or MAR, is a caregiver's roadmap for safe opioid administration. It contains crucial information about a resident's prescribed medications. Caregivers must review the MAR to ensure they are giving the correct medication to the correct resident. Familiarity with the MAR format is essential. Any uncertainties should be clarified with a supervisor or nurse. The MAR is a legal document, and accuracy is paramount. By treating the MAR as a vital tool, caregivers can help ensure appropriate pain relief while minimizing errors. Verifying dosage and timing is critical in safe opioid administration. Caregivers must ensure they are giving the correct amount of medication at the prescribed time. Double-checking the dosage on the MAR against the medication container can prevent serious errors. Awareness of potential medication interactions is important. Timing is crucial. Giving medication too early or too late can affect its effectiveness and increase side effects. Reliable timekeeping methods and adherence to the medication schedule are essential. By paying close attention to dosage and timing, caregivers can ensure residents receive the full benefit of their pain medication. Accuracy in these areas is fundamental to responsible opioid management. Secure storage and inventory control are essential in opioid management. Opioids must be stored in a locked cabinet or drawer, accessible only to authorized personnel. Regular inventory checks involve counting all controlled substances at the beginning and end of each shift. Discrepancies should be reported immediately. Robust security measures and regular inventory checks minimize the risk of opioid diversion. These practices ensure that opioids are used only for their intended purpose. Maintaining a safe and secure environment is crucial for both residents and staff. Documentation and reporting are integral to safe opioid administration. After administering an opioid, caregivers must document the date, time, medication name, dosage, route, and their initials in the MAR. This creates a transparent record of medication administration. Caregivers must report any concerns related to opioid administration or potential misuse. Prompt reporting allows for timely intervention and prevents minor issues from escalating. Accurate documentation and prompt reporting contribute significantly to resident safety. Opioid misuse can manifest in subtle behavioral changes. Caregivers, with their regular interaction with residents, are uniquely positioned to observe these shifts. Sudden confusion, disorientation, or memory problems could be a sign. Uncharacteristic drowsiness or changes in mood and demeanor can also signal a problem. Increased secrecy surrounding medication is another red flag, prompting further investigation and reporting. Beyond behavioral shifts, opioid misuse can manifest in physical symptoms. Constricted pupils, respiratory depression, nausea, vomiting, and constipation are common signs. Changes in coordination and balance can indicate misuse. Caregivers should be vigilant in observing these indicators. Recognizing these physical signs early on is crucial to prevent potential harm. Persistent or worsening gastrointestinal issues should raise concerns. Caregivers should be familiar with a resident's typical breathing pattern to identify deviations. Early recognition of these signs is key to ensuring resident safety. Caregivers are the frontline soldiers in the fight against opioid misuse. Their role extends beyond administering medication to keen observation, meticulous documentation, and timely reporting. Caregivers should be trained to recognize both subtle and overt indicators of misuse. Detailed documentation of any observed changes is paramount. Clear and timely communication with the supervising nurse or physician is essential. This collaborative approach ensures resident safety. If a caregiver suspects opioid misuse, immediate action is crucial. Notify the supervising nurse or physician immediately. Secure any remaining medications to prevent further access. Document the entire incident in detail. A debriefing session with the staff involved can be beneficial. The resident should be evaluated by a medical professional to determine the underlying cause. Implementing these procedures creates a safer environment for all residents. Opioid overdose is a life-threatening emergency. Caregivers must recognize the signs, such as unresponsiveness and respiratory depression. Pinpoint pupils and cyanosis are critical indicators. Immediate action is required, following established emergency protocols. Caregivers should act swiftly and decisively. Prompt intervention can mean the difference between life and death. Training in recognizing these signs is essential. Caregivers' prompt response can prevent a potential tragedy. In the event of a suspected opioid overdose, activate the emergency response system immediately. Call 911 or the designated emergency number without delay. Clear communication with emergency responders is vital. Describe the resident's symptoms and provide their exact location. Stay with the resident and monitor their vital signs. Prompt activation of emergency services can significantly increase the chances of a positive outcome. Following an opioid overdose emergency, several steps ensure ongoing safety. Secure any remaining medications to prevent further access. Accurate documentation of the incident is essential. A debriefing session with the staff involved can identify areas for improvement. The resident should be evaluated by a medical professional. Review their medication regimen and provide appropriate counselling. Implementing these procedures creates a safer environment. Learning from these incidents helps prevent future occurrences. This training